Another very hot topic is alopecia. And here's the mechanism of action for PRP and fluid PRF in androgenetic alopecia. It prolongs the survival of the dermal papilar cells. It prolongs the anagen phase of the hair cycle. It increases the perifollicular vascular plexus, and it leads to a differentiation of stem cells into hair follicle cells. And overall studies, approximately an increase of 15% in hair diameter and density is reported, which actually is even a little bit better than with the established treatment regimes with minoxidil and finasteride. But still, you must be careful what you promise to your patients because there is a high standard deviation. That's life in treatment of alopecia. There's 3 groups of patients. In one, it works brilliant. In another group, it works well. And in one group, you have a pretty poor outcome or just mild improvements, or you just stabilize the condition. So I tell my patients, there's 3 groups. I do not know exactly to which group you belong. The evidence is good that it helps to increase hair diameter and density, but our minimum target is to stabilize your condition. And if there is good hair growth, that's great for all of us, but I can't tell you to which group you belong. So in case you're not totally happy with it, it's not a disaster. We can still do something for you. Either we can combine it with other treatment options. We can prescribe some minoxidil on top, for example, or we can also do a hair transplantation afterwards, and we already primed your recipient area. We have a better vascularization there, so it's better for your hair transplantation as well. And when you have a good management of expectations, you have a very high satisfaction rate in your patients. Studies, as I said, most of them are positive, also RCTs here, and cohort studies as well. And this meta-analysis from Evans and colleagues, 30 studies included, 29 reported beneficial results, 24 reached statistical significance, 10 RCTs included, and the meta-analysis showed that PRP treatment increases hair density and hair thickness. And if you have a look here on the forest plots, you see that these studies favor PRP versus baseline and favor PRP versus control. So there is certainly enough evidence that we can offer these treatments to our patients. This slide is interesting, as in this study, after each and every injection of PRP, measurements in terms of hair numbers and hair cross-sections had been done. And you can see that you really need at least 3 injections, better go for 4 or 5. I have a promotion in my private practice with 5 treatments because I want to motivate the patients to do 5 treatments, and I have much better outcomes since I have changed this from 3 to 5, so it's worth doing more treatments. And the interval is not so critical. Several years ago, for me, it was strictly 4 weeks. Now it's somewhere in between 3, 4, 5, 6, or even 7 weeks. Yeah. So this is not super critical, but it's important to do enough injections. And I'm very thankful to my colleagues from Canada here, to Sam Hetz from Ottawa and Jennifer Martin. Several years ago, we wrote this paper together, and I'm very happy to show you some of the pictures here. It's a patient from Sam Hetz here, and you can see a fantastic outcome after 3 sessions, 1 month after 3 sessions. Also in this patient, you see a very good outcome a month after 3 sessions. And in this lady as well. It's very interesting that in both in males and females, you can see the beneficial results. It really doesn't seem to play a big role if the patient is male or female. You see that there is a high satisfaction rate among patients, male and females, and also among the clinicians. And the likeliness of recommendation was also shown to be high, which shows that the patients are really satisfied with the treatment. As I said, when the patient is already under minoxidil, he can continue that and he can boost the results with PRP. The study is from New York University and shows a positive response in 17 out of 24 patients, so a good ratio actually. You can see here 160 to close to 200 hairs in the responders, which is a really good outcome. Also for needling and PRP, minoxidil and finasteride and PRP, there is evidence also for hair transplantation and PRP, so combine these treatments. This is another patient of mine, and I've treated him for alopecia areata of the beard, and it's just a case report. I published it, but still we both had been very happy with this outcome after 3 treatments. And the American Academy of Dermatology has not yet implemented PRP and PRF into their guidelines for treatment of alopecia, but seems like at least they see a potential. They have published this article on their website, and I have seen some European guidelines where PRP is already included for treatment of alopecia. And of course, it always takes time before things are getting new treatments are getting included into guidelines. A lot of evidence came over the last 2 years. So hopefully in the next guidelines,